guys, welcome back to Medical Coding with Blue. Today's episode is all about career advice about medical coding from a medical coder. If you're brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, now I hear a lot on my channel from people who get comments from people who are not medical coders, advice about the medical coding career field. Okay, here's the thing. If you're here, it's because you want to hear about the medical coding field from an actual medical coder. I have been a medical coder since 2008. I currently hold the Certified Coding Specialist and the Certified Coding Specialist Physician-Based Credential offered with the American Health Information Management Association. This is a passion of mine. I have had my YouTube channel since 2018. I have over 800 videos all about this career field and almost every single question that you can think of under the sun. But this video is also sort of a public service announcement that if you're hearing something about the medical coding career field from somebody who is not a medical coder, I would strongly recommend that you think twice about really putting any kind of stock into what they say, because they don't know. If you are not a medical coder and you're saying all of these things about medical coding and you have no idea what you're talking about, it is unfair to mislead people and to give them your opinion. Because yes, while everybody's allowed to have opinions, when it comes to careers and working and things like that, you can literally change the trajectory of somebody's life by giving your opinion that is, trying to lead the person away from getting into this career field. You never know if this person is meant for this career field. And if they are, they're still going to find a way to do it, regardless of whether you tell them to yes or no to do it or not. But here, this episode was inspired by a viewer comment that I got. And I want to share it because this is what I get on a weekly basis. Somebody said something and this person said this and this person in the street said that about medical coding. Guys, you don't want to listen to people who are not in the know. If they are not a medical coder, don't ask them. If they are giving you their opinion, that is fine. You can thank them for their opinion, but go and find somebody else. Don't listen to what they're saying. Because again, so many people have been led away from this career field that would have been great medical coders. But because somebody had said something, they gave up on it too easily. So here's the comment. The comment says, "That is really great advice, Blue. One of the counselors at my local workforce development office said that no company will hire brand new medical coders who have no work experience. What are your thoughts on this?" And I responded with, number one, how do medical coders get their start then? Number two, the workforce counselor is not a medical coder, so how do they know? Yes, they work at the workforce office, but really? And here's the thing. These workforce counselors, and I have nothing but good things to say about workforce counselors because that was how I got my start in medical coding. I will never forget my workforce counselor who helped me to get into this, Enrique. Is because of him that I am in this career field that I love so much, and I have this growing YouTube channel that I've had since 2018, and all of these good things that I've experienced because of this career field. But these workforce counselors are also looking at these job listings and they're seeing that yes, there's a demand for medical coders, but there's a demand for medical coders who have experience. Here's the thing. A lot of times employers are going to want medical coders to have experience because they don't want to have to train. They either don't have the time or they don't have the staff to be able to train new people that are coming in. Number three, these schools, there's a lot of schools out there for medical coding. There's a lot of good schools, but there's even more bad schools. And the bad schools being that, oh yeah, you can be on your way to a brand new medical coding career in just 16 weeks. We will teach you everything that you need to know. 4 months and 6-month programs. No ma'am, no sir. If you really want to take this seriously, if you really want to be prepared for when you get out there in the real world and not just preparing to take exam strategies to be able to pass the certification, because that's where these employers are like, oh no, we are not going to take the time to train somebody who literally has no idea what they're doing because all they were taught was how to pass a medical coding certification exam. We need people with experience. This is why I tell new people, if you've been trained very well, if you study really hard, then you should go ahead and still apply anyway, because they're going to send you that. If they want to take a chance on you, they will send you an assessment test. You will have to prove your competence. And if you can do that as a brand new medical coder, then you are on your way to getting a chance to even have the interview. They need to know that you're serious. And so that's how people get their start. You can't be scared off by people saying, oh, well, you have to have experience or otherwise, we won't hire you. And just because you see that it says a candidate must have experience, it doesn't mean that the candidate still can't apply. Okay, you still have to apply anyway, regardless of whether they're asking for experience or not. Okay, so that's the thing. But too many people want to get discouraged right away because there's not these welcome mats that are laid out for these brand new medical coders. Do I wish it was a little bit easier for new medical coders? Yes, but at the same time, I still wish that medical coders knew what they were getting themselves into, because a lot of people don't. And there's people that even ask me still today, Blue, why do I have to learn anatomy and medical terminology and pathophysiology? I just want to code. No, ma'am, no, sir. You have to be able to understand what you are reading. And to read these doctor's notes, to go over all of these things, you have to understand the language before you can actually get into coding. Because the real world is not multiple choice. It is not a test that you can just guess your way through. You actually have to abstract. You actually have to look and make sure that the documentation supports the diagnoses and the procedures that are selected. And you have to be able to apply the rules that get updated every year. So yes, there's going to be a little bit more where you're having to learn on your own, because that is what medical coders do. We learn on our own. And so if you are prepared for all of those things, then you have a better grasp of what is actually happening. But if you're going to get discouraged and you're going to allow other people who are not medical coders to sway you, that's going to that can potentially take away a wonderful career that you could have just because you're listening to other people. Okay, so if you take anything away from this message today, it is listen to a medical coder. Go ask a medical coder these questions that you have. Look through my videos, guys. I have so many videos about the credentials, about the courses that you have to take and why you have to take them. I do have some medical coding videos out where I'm demonstrating things and showing them. I don't do a lot of them now anymore because the ones that I did do, they didn't get a lot of views, guys. And you know what? At the end of the day, it is my time to make these videos and be here with all of you. And I am happy to do it. But I'm not going to make videos that are not getting watched, because what is the sense of that, right? I do have a Patreon channel, though, that I do all of the exercise stuff on. So if you're interested in that, check it out. The link for my Patreon channel is in the description box below. It is just $10 a month. If you want to subscribe for only a month, that is totally fine. It is no hard feelings, but you get access to everything that I have posted, which is crossword puzzles and word searches and exercises and quizzes and all kinds of slide decks where I'm talking about different topics and things like that. I also try to do Patreon Jeopardy every month. And that is just like the game, right? Jeopardy, where we have all of these categories and, there's all these, 100, 200, 300, 400, 500, and then you have your daily double. Yeah, I do all of that. So it's just a fun thing that I do once a month. And, if you are in that subscriber level, you get access to that. So, there's a lot of fun things that go on Patreon. So if you're interested, again, check it out below. That being said, guys, if you are wanting to get into this career field, it is a growing career field. Yes, it is going to be here. No, it is not going away. If they're telling you, oh, it's going to be sent overseas. Every business model has an ebb and flow, right? Every business model has an ebb and flow. And there's going to be times when they said, okay, well, if we send the stuff overseas, oh yeah, we'll get things done for cheaper. Well, you get what you pay for, okay? And see, that's the problem. And so when it happens with the health information field, what happens with that? There's a lot of other things that happen where the stuff has to come back and it has to be looked at by somebody who's a native English speaker, who's looking at this documentation, who can recode it, and by the time you know it, you're paying double, sometimes triple of what you would have paid if you would have had it here. So a lot of that work that goes overseas comes right back. So don't worry about that if somebody's telling you, oh, it's going to go overseas. It's not going to go overseas, all right? Oh, it's going away. It's not going to go away, because even with artificial intelligence, right? With, you know, these new programs and the software that comes up, these things have to be able to literally read the provider's mind, because the provider and every single patient that they have is unique, right? The provider is unique. The patients are all unique, and the patients have different diagnoses. Not everybody has the same thing. You may have sleep apnea. The other person may have hypertension. There's a lot of different things that people suffer from. So there's things that, you know, we will pick up in these notes, and there are certain things that's a history of. But if artificial intelligence is looking at it, it may try to pick all the things up that it sees because it's looking for words. These programs are only as smart as you're telling them to be. Okay, so again, it would literally have to read the provider's mind. Yes, there are some things like the electronic medical record that has started to make things a little bit more easier, and it provides a very useful tool for helping providers with diagnostics and everything else, like the tests and things, or, you know, just different things that they maybe didn't think of. You know, so it's just there to augment what they're doing, right? But when it comes to how they're coding and things like that, that's where we come in. That's why we have that human eye, so that we can look at it and say, okay, yes, this needs to be picked up, or that needs to be picked up, or no, not that. You know, so there's all of that. So guys, don't even worry about that. I will have people make comments and stuff like that. And again, if the comments don't make sense, and sometimes they don't, because it's just like, oh, this, and I've heard people that talk about AI all the time, delete. You know why? Because again, you're talking about things that you don't have any idea about. Okay, so with that out of the way, there's plenty of opportunity, whether you have experience or whether you have no experience. The people who have no experience, the brand new people, have to get a thick skin. That's what this field is. This field is about, you know, being very determined and being very persistent. You have to be persistent in the beginning. I have mentioned many times about applying with the temp agency. Although people foo-foo me, I will still say, go to the temp agency when you are first graduating, when you have gotten your certification, and apply with them. So that way they can help you to get a job in medical coding. And if they don't start you in medical coding, maybe they can get you a medical billing position, or maybe they can get you a position in release of information. Now, release of information is not medical coding, but you do have to have HIPAA in order to be able to do it. And of course, if you've gone through a program, if you pass the certification, you obviously know HIPAA. But this will get you in the facility. It will get you around the people that you need to be around to start meeting and making those networking connections. Because it is all about shaking hands and making connections and connecting with people to be able to get a job. So it's a lot easier to hire from within, right? Once they have a candidate in there. And so that's just another way to be able to get in. You have to be creative, and you have to think outside the box. And so again, looking through my videos, I have tons of alternative job videos. I have videos about resumes, okay? Resumes play a huge deal in medical coding, because I've seen people who are coming from other career fields that are not related to medical coding, and the way that their resume looks, it looks like they are wanting to do the same thing that they've been doing, whether it is being a nurse, because I see a lot of nurses, they will, I do resume rewrites, and so I've seen nurses who look like their resume wants to be a nurse again. Let's not talk about all the things that you did on the nursing side. Let's talk about the things that you did on the documentation side, and about the code selections and what did you see. And let's start talking like a coder. Let's start talking like, okay, we know these rules and we know this and we know about HCPCS and we know about CPT, and yeah, so those are the things that we need to highlight in your resume, okay? And even if you have no previous background experience in medical, it is okay, because there's lots of transferable job skills that you can put onto your resume. And again, I talk a lot about those in those other videos. So there's plenty of resources on my channel when it comes to being brand new, because I was there. We were all there. Everybody starts with no experience, okay? And you don't have to give your time. You don't have to work for free in order to get into this career field. You don't have to have an alphabet after your name. All you need to have to start is one certification, and that's it. And people have actually gotten their start even without the certification, because yes, you can get a job as a medical coder without. However, a lot of places like for you to have a certification, number one. Number two, sometimes they will give you a certain amount of time to be able to get your certification. So you have to keep that in mind. They may give you 6 months, they may give you a year to get your certification, but you still need to get it. And number three, you may not get paid what a certified medical coder will make if you're starting with no certification. So that's something to think about. It's not to discourage you, obviously, but it is something for you to consider when you're getting out there and you're trying to, get a job first and then get your certification. So the longer that you wait after you finish your program to take your certification exam, though, the harder that test is going to be, because you're going to start to forget as time goes on if you're not actively studying. And it's really easy to not actively study when you're not in school. So that is something to kind of keep in mind. And the other thing that I want to talk about is, if you are maybe older, this is maybe a second or third career field for you, and you're wondering, can I do this? Yes, you can. The great thing about medical coding is that it welcomes people from all ages and stages of life, from a recent high school graduate all the way to people in their 60s. When I got my start, I was starting with a lady who's age 61. She got her certification at age 61. She's still a medical coder today. I've been a medical coder since 2008. So you do the math. She's still going. So what does that say about the longevity of this career field? People are able to do this, okay? It is up to you. Yes, there's going to be times when you are going to get frustrated and you are going to think, maybe I shouldn't do this, okay? But that is natural. Those are normal feelings. I've always recommended that you guys stay out of Facebook medical coding groups, because those are the breeding ground for just commiseration, okay? Because a lot of people, they get very discouraged, and then they want to just discourage other people, and you don't want to be caught up in that, okay? So keep your eye on the ball. Keep your eye on what you want, on your goals, okay? Because if you don't, it's so easy to lose sight and lose focus of what you want to do, all right? Those people are not paying your bills that are making all these complaints or saying all of these things that are not true about medical coding. They're not paying your bills, guys, okay? They're not going to live your career for you. Only you can do that, all right? And not everything is great right away, all right? That's something else too. And in our society now, people kind of want to run away from things that are hard. How are you ever supposed to get to the good things if you don't go through the difficult times? There's going to be difficult times. I'm not going to lie about that. Yes, you will wonder, what did I do? Number one. I'll do another video about like the stages of the medical coding student, but you're going to wonder, what the heck did I get myself into? You got yourself into a career field, and for better or for worse, you're going to get through that time, because that time, trust me, is temporary. When you start getting into your groove and you start learning and you start practicing and you start getting motivated and you start being proactive and not waiting around for other people, not waiting around for your instructor to say, oh, I feel like my instructor's not teaching me. That's why there's that independent study list with all the books that I recommend, right? And they don't even have to be expensive, guys. That's the beauty of it. There's still plenty of really good books out there, even though they're a couple of years old, practice workbooks that you can use. And trust me, it is awesome to get that practice in. And you have your coding books to work with and get familiar with. You're going to be all set for the real world. But it's going to take you to do all of the work. This is not easy. It's not handed to you. And trust me, when you get to your career goals, whether it is being a medical coder for a while and then going up to be a lead medical coder, or being an educator or an auditor or a CDI, clinical documentation improvement, clinical documentation integrity person, you know, whatever your career goals are, because there are many different career goals with medical coding, but whatever they are, you can achieve them through hard work, through diligence, and through being positive about your abilities to be able to learn this stuff. Doctors get years to be a doctor. We have to know what doctors know while never having gone to medical school. I've said that since the beginning of my channel. So, and it is true, guys. This thing takes time. I know a heck of a lot more now than I did when I first started. So, it's possible. You can do it. But stay focused. Listen to the right people. Do your research. And don't just sit there and blindly ask people for their opinion, because they're going to tell you whatever they want to tell you or whatever they're perceiving this career field to be. Don't miss out because you're listening to the wrong people. I'm just saying. So I'm going to wrap it up. But thank you guys so much for joining me. If this video helped you, I hope that you will share it. Subscribe if you haven't already. Like this, and I will see y'all next time. Bye.